Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Tuesday, April the 6th. We're honored to be here on the territory of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. We're honored to be giving this presentation on their lands. Tomorrow, Wednesday, we'll be providing a written briefing on information relevant to the COVID-19 pandemic at around 3 o'clock. And on Thursday at 1 o'clock here from the Vancouver Cabinet Office, we'll be providing a further briefing in person, Dr. Henry and I. In the meantime, it's my honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So we've had another big day today where we've had 1,068 new cases of COVID-19 in British Columbia, 33 of whom were epidemiologically linked cases. So that brings our total to 105,988 people in British Columbia who've been diagnosed with COVID-19. Of the new cases, 352 were people in the Vancouver Coastal Health Region, 492 were people in the Fraser Health Region, 73 people on Vancouver Island Health, 106 people in the Interior Health Region, 43 people in the Northern Health Region, and 2 were new cases in people who would normally reside outside of Canada. We have now 328 people hospitalized with COVID-19, 96 of whom are in critical care or ICU. Over the last day, we've had another 3 people who've died from COVID-19, 2 in the Vancouver Coastal Health Region and 1 in the Island Health Region, bringing the total number of people in British Columbia who've died to 1,489. And as always, at this trying time, our condolences and our thoughts go to the families and the caregivers and the communities who mourn their loss. We've had no new outbreaks, and we now are down to 3 active outbreaks, 1 in long-term care, 1 in assisted living, and 1 in independent living, and 9 in acute care. To date, we've given 912,056 doses of all of the COVID-19 vaccines in BC. 87,474 were second doses. And today, we had our Get Vaccinated online vaccine registration and booking system, which started early this morning, and I know we'll have more to say about that. But this means you can pre-register, and then when your age eligibility comes up, you will automatically be contacted to book your appointment, either online, by phone, or in person. And as of today, people 71 and older, and Indigenous peoples 18 and over, and people who have their letters around clinically extremely vulnerable may book appointments. As you know, in addition to our age-based program, we continue to immunize in some of the high-risk workplaces, though our parallel worker focus program remains on pause right now as we are continuing to get more information about the AstraZeneca and Covishield vaccines, where we talked last week the safety signal that was detected in Europe. There's more discussions with the experts going on internationally, even as we speak, and the European Medicines Agency and Health Canada is involved with these discussions. We're hoping to have some more information about that very soon. In the meantime, we will be using the AstraZeneca that we have in BC to advance the age groups that are eligible for vaccine, and we've heard good news that we might be receiving additional vaccines with the Johnson & Johnson or the Janssen vaccine being available sometime near the end of this month. And as soon as we have the ability, we will jumpstart our worker program once again. So please be patient. We know that there's always challenges that we have with our immunization program, with the immunizations arriving, and we will be getting back to the worker program as soon as we possibly can. One of the most concerning things that we've been following over the last little while is the variants of concern. And with the latest testing, there have been another 207 confirmed COVID-19 cases that are variants of concern in the province. All but one of these was in the Vancouver Coastal Health Region in the last little while, one in the Fraser Health Region. So that brings the total of cases that are the variants of concern to 3,766. It is important to note, however, that of the total cases, these 3,700 and some, we now have only 266 which are active cases. So that's about 3% of our active cases right now. So that tells you a couple of things. One, that there's a time delay before we can confirm that a specific variant is causing illness in people. And that is important because we take the same measures for every single case that's identified, because we cannot know immediately whether there's somebody who has a variant or not. And that has been what we've been doing in public health since the emergence of the understanding that some of these variants were coming or were here in BC. I will also note that we have of the people in hospital right now, 63 of them are people who have been identified as having one of the variants of concern, primarily the B117, which is 42 of the 63 people in hospital right now, and that's about 13% of our hospitalizations. 20 of the people in hospital right now are people that we know have the P1 variant. That's about 6% of people in hospital right now. And there's one person that we know with the B1351, which is the South African variant. So that gives you a sense of the proportion of people that we know have these variants of concern. So far, it is the B117, the UK variant, that is dominating what we're seeing now in British Columbia. It's not the most common strain that we're seeing, but of the variants of concern, it is the most common, with 2,838 people identified carrying this strain. 51 people with the B1351, the South African strain, and that has mostly died down. We have not had new cases of that for a little while. What we have seen, though, is an increase in the last few months or few weeks of the P1 from Brazil. So this is a strain that we are testing for, screening for, and doing whole genome sequencing. And we now have 877 confirmed cases with this P1. 106 of them are active cases, so about 1% of these cases, 1.2%, are now active. Again, about 2,500 of all of the VOCs are people who live in Fraser Health, and that's just up by one right now. 1,128 are in Vancouver Coastal, and that's up by 206. And the majority of the P1 that we're seeing in BC are people who reside in the Vancouver Coastal Health Region, primarily part of them in the lower mainland part of Vancouver, and a good proportion in Whistler. About 197 are people of the several thousand, the little over 1,000 people who've been identified as having COVID-19 in Whistler, so a small percentage. And about 20 of the cases are on Vancouver Island, 103 in the Interior Health, and 15 in Northern Health. So when we look at these variants of concern, we've been following them through our laboratory surveillance since the concern first arose, and we watched what happened in the UK. And what we know is that viruses, by their very nature, mutate and change. And as more transmission happens, if there's more virus transmitting, it means it's changing, it's replicating more often. The opportunity for these spelling errors or mutations to occur goes up. And we saw them. That's why we see these variants arise where there's lots of cases happening in the US, in Brazil, in the UK, for example. Sometimes a mutation, so a spelling error, will occur that gives that strain of the virus a competitive advantage, and it will spread faster and take over transmission. And that's what we saw in the UK, and that's what we're seeing here in BC and in other parts of Canada. And for us, it's the B117 strain that seems to have that competitive advantage and is taking over. Since the beginning of the pandemic, we've seen several variants that are more common. And in the last 2 months, it's the B117 that's taken over about a third of our cases. But we expect it will continue to increase. And we know we've seen that happen, that when it gets that competitive advantage, it can spread more easily. It's the one that tends to increase more rapidly. We've seen in Ontario that now it's about 60% of all of the new cases are with the B117 strain in Ontario. And we're probably a month or so behind Ontario in getting there. We know that this happens. It's the way that viruses evolve over time. We've seen as well that we've done a lot of testing for variants in British Columbia. We've had a strong whole genome sequencing program where we started very early on, and we've presented that data from the very beginning, where we had cases that we could associate with China, with Iran, with Washington State, and we've been following this for some time. And the variants that we've seen most commonly are ones called B112, and now we're starting to see other ones come as well. We've also done whole genome sequencing in over 19,000 specimens, and so that's way more than most countries in the world. So the numbers are higher here. But the percentages are increasing at a similar rate that we've seen in other countries and other places in the world. So we also are doing screening of over 90% of the positive cases that happen every day. So there's a second test, a screening test. It's called a single nucleotide polymorphism test, or a SNP test. And it looks for some of the common mutations that help us identify if it's one of those variants of concern. So the changes that we think make the virus transmit better. And these are things like the N501Y, which is one of the parts of the spike protein, and the E484K, which is also part of the spike protein that we think gives this advantage that they can attach better. But we need to confirm these screening tests with whole genome sequencing, and that is a much more involved process that can take several days. So sometimes we'll get a screening positive, but it'll turn out not to be one of the variants of concern. It may be another variant that is carrying that similar mutation. And that's important for us to know as well, because it is a very real possibility that other variants will arise, or other mutations will give another strain of this virus some competitive advantage in the future. So the whole genome sequencing tells us that there are a bunch of variants circulating, and that these have mutations. We have ones from the US, from California, India, Nigeria, some that were recognized in the Philippines. We have the P1 that we're talking about here that arose in Brazil but was seen also in Japan, and it's unclear whether it came to us through directly through Brazil or through Japan, or very likely from inter-provincial travel in Canada. We have the B117 UK and the South African, but we also have the P2, which is another strain that is causing a lot of illness in Brazil. And it's slightly different from the P1 that we're seeing here. So what we can tell is there's a whole landscape of these different viruses and different variants that we're following. And we see that some of them can really take off. Usually one strain will outcompete the others at any one period of time. And for us right now, that is the UK strain. And it is now found, the B117 is being found all over BC, in much smaller numbers outside of the Lower Mainland, but it certainly is being found everywhere. The P1, which I talked about, Brazil and Japan strain, was introduced more recently. We didn't see it in the earlier screens that we were doing. We had one contained cluster in February in Vancouver, but then we had several different introductions in Vancouver and in Whistler, probably in mid to late February. And these ones had several different chains of transmission. So it wasn't one single cluster or super spreader event. It was many different chains in the many chains that were happening in and around Whistler, as we know. We were doing a lot of testing, and there was a lot of transmission happening in young people and people who were visitors to Whistler as well. And it is likely, through contact tracing, it was likely that that visitors from other parts of Canada initially introduced that strain, but then it started to circulate in some of the chains of transmission in Whistler as well, between workers, visitors, and from there spread to other parts of the province. And we know that there was quite a lot of travel over the March break to and from the Lower Mainland and other parts of BC. So a high percentage of the P1 that we've identified in our province through our screening program is associated with Whistler or travel to Whistler, but it is still a small percentage of all of the cases in Whistler overall, and a small percentage of the cases in Canada. And we think that this peaked about the week of March 22nd. Most of the cases have been identified, and it's through the good work of our public health teams around the province that they've identified the cases and contacts, and we're stopping those chains of transmission. But as we know, that takes time because the incubation period is 14 days, and we are now seeing that people are having a lot more contacts than they were before. We see that in not only the active cases increasing, but the number of people who are in isolation increasing quite dramatically as well. Over the period of much of February and March, we were seeing relatively stable but high numbers in the 500s, but the number of people who were active cases and the number of contacts was relatively stable. And in the last 2 weeks, we've seen both of those go up quite dramatically. Cases have surged and people are having a much higher number of contacts, and that has meant increased numbers of people in hospital, and we know that much of this transmission is happening in younger people. So that means numbers of younger people in hospital has increased, and numbers of younger people needing ICU care has increased, and that is concerning. It is because these variants transmit more easily that we are seeing more people becoming ill in those numbers of contacts that they're having, and proportionally more people requiring hospitalization and, of course, critical care. So we have a pretty good idea about B117, that it is increasing, it is taking over, it's the one that we're seeing most commonly. And we are watching carefully now to see if there's any impact on things like the effectiveness of the vaccine. So far, we are not seeing that, and this is really important. We want to make sure that our vaccine programs are still going to be robust and strong, and one of the important things that we've done from the very beginning is ensure that we can link every single person who's had their vaccine and if they've tested positive for the virus. So that is part of the good work that my colleagues at the BC CDC are doing and that we're watching very carefully. We have not seen any negative effects on our immunization program yet, but of course we will continue to watch that. And we need to use our surveillance resources because we have a limited capacity to do whole genome sequencing, to focus on making sure we can detect if any other new variants that have some different mutation arise in the province as well. And that is part of what we will be focusing on in the coming weeks. So concerningly, much of the increased transmission we're seeing in the last little while is being driven by social gatherings, where people are disregarding our provincial safety precautions for a whole lot of reasons, and we know that. There's no one cluster, one cause. It is happening everywhere, and people may be staying to small numbers, but repeated different small numbers. And it's particularly notable in our younger demographics now, because many young people live, work, and socialize in the same networks. For example, we know a classic, what we have seen many times, is people may work at the ski hill, but share a house or accommodation with 6 or 7 other people. Some of them may work at a restaurant, or at one of the bars, or at one of the retail outlets. And then one of them becomes positive, it spreads to others, and before we know it, it's spread to a number of different workplaces as well. This is a classic spread of chains of transmission that we've been seeing across the province in the last little while. Another example is something we've seen a lot. People decide to have a few friends over to socialize, and then one of the friends has COVID-19 without recognizing it. The next day, they go to a backyard barbecue with a number of different friends, and that drifts into an evening going out socializing. And then Of the 10 people that were there, they go to their workplaces in the next few days, and it gets spread from there. And this is something that is not new. We've seen this in BC, we've seen it around the world. Unnecessary travel and social gatherings are fueling the fire for the variants of concern transmission as well. But we all have the ability to slow that down. And this is a time where we can do that. All of our connections need to be safe connections. We need to have those interactions at a distance, wearing masks, making sure we have small numbers of people and the same numbers of people. I know for many people who have been doing just that here in BC, it has been a very hard and long year, and it is discouraging to see the surge that we're experiencing right now. Let me just say thank you. I know people are doing their best, and we have to deal with what we have right now. We'd all wish it to be different, but we need to deal with what we have in front of us today. The virus is adapting and is taking advantage wherever it can, and it isn't fair. But we are together in this storm, and now we have vaccines on our side as well. There will be an end. Of that, I am confident. And we will be in a very different position by this summer. And that is a prediction that I will make right now. But right now, we do not yet have enough people protected. Those around us, our young people around us, our elders, our seniors, with vaccines to keep our communities safe right now. With every single person that does get a vaccine, we all become a little bit safer, and we will get through this next few months until all of our communities are protected. But right now, if you choose to spend time with anyone other than your immediate household, it must be outside. It must be done safely. It must be small. Let's ensure we don't lose any more ground. We can get through this surge as well. It's the hand that we've been dealt with, and we have to work together to get through it. Let's all pledge to do our part today to break these chains of transmission that we're seeing now. Making exceptions or bending the rules just gives the virus the edge, and nobody needs that right now. So let's stay strong and stay together in this storm by staying apart and remembering that we can do our bit, and be kind to each other, and being calm and staying safe. Thank you.
Thank you very much, Dr. Henry. I want to start by expressing my condolences to the families, the friends, the caregivers of the 3 people who passed away related to COVID-19 in the last 24 hours. 1 in the Vancouver Island Health Authority, 2 in the Vancouver Coastal Health Authority. It is a difficult time to grieve, and I want everyone to know that we are thinking of them and grieving with them today. I wanted to note we have 328 people hospitalized for COVID-19 in BC, 96 in critical care. And I want to put that in context. Currently, our occupied bed rate in BC is 89.5%. That's significantly below what it would have been pre-pandemic at this time of year. So that means that there are 985 vacant base beds in our hospitals across BC. And when you add the surge beds that we've added to prepare for COVID-19, there are 3,416 vacant beds. In critical care, there are, our capacity is 75.8% of base beds, meaning there are 130 vacant critical care beds. And when you add the surge beds that we put in place, 360 critical care beds that are vacant in BC right now and ready to take patients should that be required. What that says over the past week, just to put it in context, and the preparations that our outstanding teams in acute care have made, we've gone from a bed capacity over the last week of 91.1% a week ago to 89.5% now, 77.7% in critical care to 75.8% now. That's a base bed capacity, not counting the surge beds we've added. That doesn't mean things are in any way anything other than very challenging in acute care right now, that having COVID-19 patients, an increased number in critical care doesn't make a major difference. Having outbreaks in some acute care hospitals doesn't make a major difference. But it's to say that our teams are prepared and they're ready. And if you need hospital care in BC, it is there for you. And the preparations that have made and the actions that we can continue to take should the situation become more difficult are ready to go as well. Today, as you know, we opened our online registration and booking tool. As of 2 o'clock today, 160,464 British Columbians registered for their vaccine. 23,827 appointments booked today. So when registers, you get an invitation, then you book if you're in a currently eligible category. And that is, of course, people aged 71 or older, born in 1950 or before, people who are clinically vulnerable, and Indigenous people, all Indigenous adults. Those are the people who who will be able to book appointments right now, but people can register right now. And as you can see, more than 160,000 did so today. And I want to thank and congratulate the teams that have been involved in launching this online registration and booking tool. I think they've done a very good job, and I encourage all British Columbians to engage and get prepared. And the fact that there is so much interest in vaccination shows, I think, the commitment of people across BC in dealing with COVID-19. I just want to mention as well the AstraZeneca program, because there are questions about this. As you'll know, on March 29th, the decision was taken to pause the frontline worker program due to the safety signal for the AstraZeneca vaccine. In response to that safety signal and in cooperation with the BC Pharmacy Association, we made the decision to distribute the remaining Covishield to pharmacies in the Lower Mainland to enable the urgent deployment of outdating doses. That was about 14,100, and the remaining 17,629 doses, which are good to use until June 2021. The target group for vaccinations through pharmacies is 55 to 65 years of age. Over March 30th to 31st, the remaining 31,729 doses of Covishield were delivered to 112 participating pharmacies in the Lower Mainland through the pharmacy distribution system. We were able to use the outdating doses of Covishield prior to expiration. On Thursday, April 1st, 188,000 doses of AstraZeneca arrived in BC of a total expected shipment of 203,000. The remaining 15,000 doses are on their way and set to arrive in the next day or so. From the 203,000 doses, a significant portion is being moved to an expanded list of participating pharmacies in Metro Vancouver, including Sea to Sky and Sunshine Coast, and other key communities across BC, including Prince George, Fort St. John, Terrace, Dawson Creek, Kelowna, Kamloops, Vernon, Parksville, Nanaimo, and Victoria. We expect by Thursday or Friday of this week, vaccine will be in those communities at participating pharmacies and ready for administration to those aged 55 to 65. Specific information on participating pharmacies will be provided by health authorities and the BC Pharmacy Association, so stay tuned for that. On April 9th, we expect that a further 42,900 doses of COVAX AZ AstraZeneca will arrive in BC. We will continue to use this vaccine in the most efficient way possible as it arrives. This was a very challenging weekend, as all of you know, in our COVID-19 fight. It's us and the vaccine against COVID-19. That fact has never been clearer. 19.2% of the 4.2 million eligible British Columbians have had their first dose of our available vaccine. Even with that progress, it all comes down to this week and how we make a difference, we make the most of it to stop the spread. We won't see the results right away, but it's the difference we make now, this week, that matters. When faced with behavior that goes against COVID-19 guidance and orders, we must hold fast in our consistency in taking actions that keep us safe from the virus and its spread. We must, and it's pretty simple, whether you're 25 or 35 or 45 or 75. If it's not essential travel, don't go. If we're invited to an indoor gathering, don't show. If we think it's unsafe, say no. Don't go, don't show, say no. This week, we must make the difference that matters. Every one of us must remember what we've learned, rely upon what we know, and do what is right. And every one of us needs to make the big commitment now to stop the spread. Aujourd'hui, nous annonçons 1068 nouveaux cas qui ont testé positifs pour COVID-19 pour un total de 105 988 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 3 nouveaux décès liés au COVID-19 pour un total de 1489 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 328 cas sont actuellement hospitalisés, dans 98 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
As a reminder to reporters on the phone, please press *1 to enter the queue. You will be limited to one question and one follow-up. Please also remember to take your phone off mute. You will not be audible until your name is called. Our first question today is from Katie DeRosa, Vancouver Sun. Please go ahead.
I'm wondering if you could provide details on what percentage of the cases that go through PCR screening test are then put through whole genome sequencing. Is it different based on areas such as Whistler, where you know that there's been a presence of a variant, or what's the most up-to-date information on the percentage that do get through whole genome sequencing?
As I said, about 90% of our every positive test across the province are screened with one of the SNP tests, and if those are positive, they go to whole genome sequencing. And right now, that's a little bit, as you say, a bit of a biased sample, because we are getting more of those positives from places where we know there's circulation of variants. So it is primarily in the Lower Mainland, but all of the ones that are positive right now on the screening test are going through whole genome sequencing. What we are looking at doing is trying to, now that we know that the B117 in particular is fairly prevalent everywhere, we're looking at just screening those ones and saving the whole genome sequencing capacity to be able to do more systematic, unbiased testing of random samples, basically, because we only have a limited capacity per week. So we're looking at doing that with our laboratory partners over the next few weeks.
Do you have a
As a follow-up, there are some epidemiologists and modeling experts who have said that other provinces released the information on the PCR screening test, and that BC could actually have a falsely low number of variants confirmed, and especially, as you mentioned, there is a little bit of a delay. So is the public getting the full information on the variants of concern, and is there any credence to perhaps releasing the PCR test without breaking down the specific variants, whether it's P1 or the UK, and then following up with the whole genome sequencing numbers?
Yeah, we can do that. We have been doing a combination of that as we've increased the screening that we've been doing. The health authorities get the preliminary positives, and as I said, we've been treating all of them as potentially variant cases, especially since we've seen the increasing proportion. But it really, we've been doing a lot of whole genome sequencing on all of the positives, and the screening is more sensitive, so not all of the screen tests are actual variants of concern. So, but yes, we can look at that. I mean, it's not. It really gives an inflated number of ones that are not necessarily any of the variants that we're worried about, but they are ones that we want to look at. There are many different, and the same mutation is in many different variants of the hundreds that we see in the province.
Our next question is from Justine Hunter, Globe and Mail. Please go ahead.
I was just wondering that the 300,000 workers who were told they were going to be getting the vaccine, that program's now on pause. I'm wondering what happens when you get an update on AstraZeneca. Do you pull that pharmacy supply and return it to the priority frontline workers, or is there some other option?
Yeah, so obviously we're looking at a whole, whatever option we can do. What we didn't want to do was hold up use of the vaccine while we were waiting. So this is what we're doing right now. We can also stream workers through the pharmacies where the vaccine is. So we will be looking at that in the next little while. I will say that with the initial amount that we did receive and with our program that we have been from the very beginning looking at managing outbreaks in workplaces, we have gone a considerable way at some of the highest risk workplaces. So we call it the food and farm. So we've done a lot of the manufacturing, the food processing plants across the province. We were able to do much of that before we had the safety signal using combinations of vaccine that we had available, as well as some of the larger outbreaks in manufacturing and the group accommodations in farms, and making sure that we continue to provide protection to the temporary farm workers, for example, who are going to be working and living in crowded accommodations on farms. So we've gone a long way to getting some of the highest risk industries, but we're not where we want to be, obviously, and we're looking at how do we best restart that program as quickly as we can.
Do you have a follow-up?
For those communities that had now are going to be seeing the AstraZeneca supply coming through the pharmacies, can you give us an idea of how many people will be in that eligible age group of 55 to 65, and then how many doses of the vaccine will be available for distribution through that?
So we have about 700,000 people in the province between the ages of 55 and 65. So as you can tell, we do not have enough vaccine to provide it to everybody. But it's a way of jump-starting that part of the age group as our main focus with the AstraZeneca and the Moderna vaccine and the age-based program moves steadily down the age range. So we have about 200,000 doses in the next couple of weeks. It's been part of our challenge. We are expecting in Canada to get more from the Serum Institute of India. However, we know what's happening in India right now, and there's quite a large surge and an outbreak there, and they are using almost all of the vaccine that's being manufactured right now domestically. So we don't know when the next supply of that will come in. So what we're trying to do is match as best we can supply when it gets here, getting it out to people as quickly as we possibly can. And I don't know if you want to talk about the, yeah, so what we're doing, it is proportionate to population in different communities, and really focusing on those communities that are having the biggest challenges with transmission.
Our next question is from Richard Zussman, Global News.
Dr. Henry, there has been some reporting that the outbreak involving the Vancouver Canucks involved the P1 variant. Can you confirm that that is the case? And if it's true that the P1 is involved here, this is an organization that has been following strict COVID protocols. Should people be worried that the P1 variant is overcoming the guidelines and restrictions that have been put in place, not just with the Canucks, but in many other sectors of our lives, that P1 is breaking through those chains of transmission that we have, or those barriers of transmission we have created?
Yeah, so I'm not aware that any of the cases in the Canucks organization are related to P1. I don't know where that started, but not that I'm aware of. And, you know, it just tells us that once this virus gets hold, it can spread very quickly, despite having routine testing protocols, having protocols to try and protect people as much as possible. And, you know, my heart goes out to the Canucks, and I know Vancouver Coastal is working very closely with them to make sure that they get the support that they need, that the team members and their families are assessed and tested and get the health care that they need as well. But this is a reminder to all of us that this virus spreads very easily. And it spreads easily in young people, and young people can have very serious illness sometimes. And I know that even with the best of intentions, once it gets in, and it can spread without people recognizing it. So this is a cautionary tale for all of us. And for young people, and we've seen this happen in Whistler, in other parts of the province as well, that we think it's okay to have those interconnections with our network, but then we go to work and we spread it, and the chain spread from there. So it is a reminder that this virus can spread so quickly, even when we're trying to be careful.
Richard, do you have a follow-up?
In comments, you said the virus is adapting. So what is British Columbia doing as a province to adapt to the virus? Will there be further restrictions in place? Could schools be closed? Are there measures that will be taken by yourself and other health officials to adapt to the virus?
Yeah, so what we are learning as well, and this is how we adapt, we're learning that, yes, some things transmit more easily, but the same measures that we take make a difference in preventing that transmission. And we have the measures in place that we know will work. We have restrictions on size of gatherings that you can have. We've talked about the importance of, if you do want to get together with people, I recognize we need those social connections after this period of time. We need to do it outside. We need to keep our distance. We need to keep safe. So those things are still the same, and we need to make sure that we're following them. I think we had some complacency. We have some sense of we can get through this and that it doesn't really affect young people. But we see as more younger people, we've changed the epidemiology by protecting people who are most at risk of having severe illness. But when we have lots of cases in young people, a percentage of them will end up in hospital, will end up in ICU. And that's what we can all prevent by taking the very simple measures that we all know by now and that we're sick of, but work. And in terms of schools, of course, we've talked about that. We've been in touch with our counterparts in the Ministry of Education, with the superintendents, with the school districts and principals and teachers. And, what we have also learned is that we see cases go up when children are not in school. And that is often because they have other unstructured time, and that children need school. We know that it is a safe place for them where emotional, physical, as well as educational growth happens, and that families and communities are best supported when we have children safely in school, and so we'll still be focusing on that.
Our next question is from Penny Daflis, CTV.
Hi there. Thanks very much. I just wanted to start with a question from one of my colleagues. We're hearing urgent calls to vaccinate younger frontline workers to combat the rapid spread of the disease. And with AstraZeneca only available for those 55 to 65 for now, would you consider diverting some of the Pfizer and Moderna doses that are now destined for the age-based vaccination program instead to frontline and essential workers in BC?
So all along, we have been targeting those higher risk workplaces, and I think I mentioned we started a workplace task group in November last year when we started to see increased transmission with our second wave. And so we have been working with WorkSafe BC, with the environmental health officers, our public health team, to manage workplace outbreaks and to identify those highest risk ones. So we have targeted both Pfizer and Moderna and AstraZeneca when it was available to the ones that are highest risk. And we absolutely recognize, there's people who work in our food processing plants. Often both parents are working. They don't have necessarily the ability to take time off. It's very difficult in those environments to wear PPE every day and to have the barriers in place. So we have directed vaccine at protecting those workplaces. And we also know that our first responders in particular, who are doing an amazing job in a very difficult circumstance, but they also are having very low rates of transmission. So this is the good news, and we are continuing to support them and to make sure they have what they need to protect themselves. And as soon as we have vaccine available, we will be restarting that program. But we've been managing the highest risk workplaces first. And And quite frankly, they often are the larger workplaces where people are more poorly paid, and we know that it involves many of our racialized communities, people who live in large multi-generational homes sometimes. And so that has been our focus to start with. But yes, we are looking at how we can get that program back and running as soon as possible.
Penny, do you have a follow-up?
I do. Just based on your comments today, it almost seems like you're trying to minimize the variants. You emphasize small numbers. In the past, you've described it as a simple replacement of traditional COVID. But experts keep telling me the trajectory is the same everywhere when variants show up, and that's a rapid takeoff. You know, we're also now hearing from frontline doctors raising the alarm as ICUs fill up, and yet we aren't ramping up with the aggressive testing or doing anything substantive since variants arrived other than closing restaurants. So I'm just trying to understand why you aren't doing more in response to an aggressive form of the virus, because if Ontario's a month ahead, like you mentioned, they've got lockdowns and school closures, why not be more proactive now instead of reactive a month from now?
Yeah, I think you misunderstand what I said. What I said is we're treating all of these as if they are variants. So we have been doing aggressive case management. That is something we have been doing from the beginning. We got overwhelmed at one point in the fall, and we've built up those resources again. So every single case is contacted. We are doing contact tracing, both to try and understand the chains of transmission and block them. That's how I know that people are having more contacts now than they were having a few months ago. We are doing extra testing of people, and you've seen that in some of our school exposures where we've tested whole cohorts. For people that we are doing testing of asymptomatic contacts. We're providing support to people to isolate away from their household contacts. So we are doing all of those things as aggressively as we can to try and prevent that rapid takeoff. And we had been finding a relative balance, but unfortunately what we're seeing is that the numbers of contacts that people are having and those social networks have been expanding in the last little while. So we need to work together on this and to pull it back down.
Our next question is from Marcella Bernardo, News 1130. Please go ahead.
Dr. Henry and Minister Dix, just considering what's happening right now in Ontario with numerous schools ordered to close, why is there no urgency to do the same thing in hot zones here like Vancouver Coastal at Fraser Health?
You know, we've talked a lot about the biggest, the highest risk in our community is in the city of Surrey. That's where we have the highest transmission rates, largest population, where we have taken the most additional measures. We've been working, we have a school team as well that's been working with the Surrey School District, for example, to revamp all of the COVID safety plans in those schools to make sure that we have them in place for when school returned last week. We've immunized in those schools as well. So these are things that we are taking now to mitigate the risks that we know are in our communities. And we're focusing on the communities with the highest risk. And we know that it's Surrey. We also know that cases go up when children are not in school, and that the downside impacts on families is immense. So we need to find that way of safely keeping children in school so that we can protect our communities. And that is something that we take very seriously, that we've put a focus on. I think the other thing, you know, that we need to remind people is we've also been stepping up our COVID safety plans in workplaces. And we are and will be shutting down workplaces where there's transmission to make sure that we can try and stop those chains. But, you know, this is something we are all dealing with. It's not simple to put bubble wrap around everybody and prevent transmission. We all have a place and a role to play in stopping it right now. We know that with these increased numbers that we're seeing, we are likely to see more people hospitalized and more people in ICU. And I know my colleagues in ICU are tired. And it's hard when we see young people being admitted and young people being put on ventilators. But we need to stop this upstream in the community, and we all play a part in that.
Marcella, do you have a follow-up?
I do. I know you touched on this a bit earlier, but why do you think, or why can you, if you could explain, why wasn't Whistler shut down sooner when there was evidence of the Brazil variant there before spring break? And now we're hearing about numerous exposures at 3 Vancouver private schools linked to a party at the resort during spring break.
Well, I think that somebody feeling that it was okay to go partying in Whistler with what we knew, you know, that's not the type of behavior that we need right now. We have been following, as you know, Whistler has had about 3 increases in waves, if you will, since January, where we've had quite a lot of transmission. And again, in social connections and people who are living in the group accommodation there. So we have been taking very aggressive measures up there. Vancouver Coastal Health has been working closely with the resort municipality, with the businesses in the area. We've done everything from pop-up testing and routine testing, and more recently was able to provide vaccines to several thousand of the workers in the community. But then when we started to see things take off again, we realized that we needed to take more drastic measures.
Our next question is from Tanya Fletcher, CBC. Please go ahead.
Hi there. First of all, on restaurants, some restaurant owners say they would have been happy to comply with your orders if you'd given them a heads up instead of just 12 hours, where in some cases establishments without patios would lose most of their thousands of dollars in inventory because of the immediate closures last week. So what's the message to those asking why you didn't give them a warning to prepare if your goal is to keep the economy functioning as much as possible?
Yeah, so our goal is to keep things safely functioning as much as possible, and we have ongoing communications with the sector. And I do want to commend the BC Food and Restaurant Association. You know, they have been a strong supporter. They've been lobbying and working on behalf of their members and supporting. We have ongoing communications about what's happening, about where risks are, and the measures that we might need to take. And right now, these were the types of things that we knew were a possibility because of the transmission chains that we were seeing. And restaurants are part of it, bars, some of the other settings that we were seeing as well. So, you know, it is one of those things that we try and keep that balance as long as we can. But once it's tipped over, we need to take action, and action quickly. And that's what we did.
Tanya, did you have a follow-up?
Yes, please. And if we could get an answer in French from Minister Dix as well. This is regarding young people and variants. You said again today cases are rising in young people and that more of them are getting sick now. But the publicly available data on hospitalizations is now 2 weeks old. It so far doesn't reflect this in a very detailed way. And so of the 207 cases, variant cases identified today, can you say how many affect young people specifically? And if this surge in young people is real and serious, then why can't the province get this information in a quantifiable way sooner?
I'm not sure why, you know, the BC CDC dashboard does have age groups. We get that weekly in a number of different ways. So we can, I'm not sure what you want, to be honest. Of the 207 people, I don't have the age breakdown in front of me, but we know that the average age is younger. The average age of hospitalization is still in the 60s, but we are seeing increasing numbers of younger people as well. Yeah.
And just so we understand, because the variants are different in different health authorities, that overwhelmingly in Fraser Health, it's the B117 that is the dominant variant, 2,293 of the 2,500 cases. In Vancouver Coastal Health, it's the P1 variant that's sometimes associated with Brazil that has the majority of cases. So, significantly over 90% of the cases in Fraser Health are in fact the B117 variant. The median age today is 30. The median age is 30 in the Brazilian case of the Brazilian variants, 33 overall with all the variants, and 35 in the UK variant. So that provides you with that information, and that's as of our report on April 6, 2021. Je dirais en français que nous avons présenté des renseignements sur cette question de variants, mais il faut de reconnaître que chaque cas de chaque test positif de COVID-19 a en réalité la même importance. Il faut le traiter d'une manière équivalente pour tous les cas, parce que tous les cas sont importants. De plus en plus, en partie parce qu'on a vacciné beaucoup de gens de troisième âge dans la province, on va avoir comme pourcentage plus en plus de cas parmi les jeunes. Et aussi, il y a plus de transmission parmi les jeunes. Mais il faut reconnaître aussi que l'âge moyen des gens à l'hôpital, par exemple, dans la régie de santé de Fraser, c'est 65 ans. Donc, c'est toujours des gens qui sont de troisième âge, qui sont plus âgés, qui sont plus à risque. Cela étant, il y a beaucoup plus de monde qui sont jeunes, qui ont des tests positifs pour COVID-19. Et je pense que pour tout le monde, on a 25 ans, on a 35 ans, on a 75 ans, c'est la même chose. Il faut prendre l'action pour se protéger contre le COVID-19 et aussi pour protéger tout ce qu'on aime.
That's all the time we have for today. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. Thank you everyone for joining.